Hello and welcome to Traditional Chinese Medicine Tongue Diagnosis. My name is Christina Kapo-Thanasis. I'm a licensed acupuncturist here in the state of Hawaii, and I am a diplomat of Oriental Medicine under the National Certification Commission for Acupuncture and Oriental Medicine. I'm also the Executive Director of the Hawaii Oriental Medicine and Acupuncture Association. Today I'm excited to share with you an episode on tongue diagnosis, and hopefully you can follow along today if you have a second to grab a mirror, and we'll look together at your tongue and see what it's telling us about your body. Tongue diagnosis is an important part of traditional Chinese medicine. Traditional Chinese medicine is a complete system of medicine that includes diagnostic techniques like tongue impulse diagnosis and treatment methods like acupuncture, herbal medicine, and other remedies. Today we're going to look specifically at tongue diagnosis and what it can tell about the body. Chinese medicine looks at two main parts of the tongue. We focus on the body of the tongue, or the skin, and we focus on the coating of the tongue. Some people have a thin or thick coating on top of the tongue, and some people scrape their tongue in the morning. That is the coating that we're looking at. The body of the tongue can tell us things about the qi in the body. Qi, a rough translation into English, would be the energy that flows through our body. It is not connected with the nervous system, cardiovascular system, or lymphatic system. It is a separate system flowing through meridians in the body, and it can tell us about the quality deficiencies of the blood in the body. So if we look at the coating of the tongue, it's looking more at the strength or weakness of the digestive system and the different pathogens and how much they are affecting the body. When we put those together, we can get a complete look at the nutritional state of the body and the metabolic state of the body. The process of taking the tongue diagnosis is relatively quick. All you have to do is stick out your tongue for a few seconds and let us take a look. When you do stick out your tongue, we ask that you are very relaxed when you stick it out, and we get a full clear picture from tip to back. So we just look at it for a few seconds up on the top and underneath to get a good look at what's going on. So we would like you to open your mouth wide, sort of like saying ah, and stick your tongue out like so. What we don't want you to do is open your mouth too long and look at your tongue for too long. That changes the color of the tongue. If you hold your tongue out too long, it can turn a little bit purple after a while, or red. If you use too much force to stick your tongue out, it can change the appearance of the tongue too. So we don't want to make a skinny kind of tongue. Does that make sense? Okay, good. Some of the qualities that we look at, we take the qualities and we look at them one at a time. So if you can look at this first slide, the different qualities that we look at on the tongue are the tongue color. So we're looking if it's too red, too pale. We're looking at the size of the tongue. Is it too small and thin? Is it too enlarged, filling up the cavity of the mouth, or just right in between? We can also look at the coating thickness, how thin, non-existent, or thick it is, and we look at the color of the coating, how yellow or white, and sometimes tinge of gray or brown. We also look for the moisture of the tongue, how dry it is or how wet. Sometimes there's much saliva on the tongue. And we also look underneath the tongue. Some of the special signs we look for that not everybody has, but some abnormal signs, we look for scalloped edges, we look for red dots distributed anywhere on the tongue, and we look for different purple bumps and patches. These can tell us several different things about the tongue. So basically we look at a couple aspects of the coating, the thickness and the color. We look at the body of the tongue for the color, and we look at the size of the tongue, and we pay attention for any special patches, dots, scallops going on. We also want to pay attention in this next slide where you can see a map of the tongue, where these special signs on and or the coating is located. Sometimes they can be concentrated in different areas of the tongue, which indicate different organs have been affected. So at the tip of the tongue is represented by the heart and the lungs. The center of the tongue represents the crux of the digestive system, the spleen and the stomach. On the sides we have liver and gallbladder, and in the back we have kidney and bladder. So different signs and symptoms can show up in different areas of the tongue, which can also give us clues as to how your body is functioning. First of all, if you have your mirror handy, we will start and classify your tongue very simply in terms of those different aspects. The picture you see here is a normal tongue. A normal tongue is pink with a thin white coating and no abnormal special signs. So if we keep this in the middle of the screen, for most of these slides, you'll be able to compare the different signs as they are abnormal compared to the normal tongue. Let's get started. Okay, first we look at the tongue color. So how red, pink, or pale is your tongue? If you can look at the slide on the left, this tongue is a little bit too red. Tongues can be all different shades of red: cherry red, dark deep red, and this one is quite a nice bright red. In the middle again we have our perfectly pink tongue. On the right hand side we have a pale tongue. Can you notice how this is a little bit whiter than the pink and definitely lighter than the red? And at the bottom of the screen we have a tongue that has a tinge of purple. So we have to see if your tongue is pink, is it red, is it pale, and it can have a tinge of purple either by itself. It can be pink with purple, it can be darker red with purple, or it can be pale with a tinge of purple. Can you see what yours is? Okay, let's go on to the next one. The next sign we're looking for is the size of the tongue. Again, in the middle we have a nice, perfectly sized pink tongue with thin white coating. On the left, if we look at this red tongue again, the red tongue is quite thin. It's quite thin this way and it's small in size this way. So this is too small of a tongue. You may ask, some people's tongue may be genetically different than other people's. We say that this is their constitution. Some people may run hot, some people may run cold. You're right, but we can see what their constitution is or what their body type is by the size of the tongue, accompanied by all the other aspects. On the right side, we can see that this tongue is quite enlarged. When they open their mouth, it fills up the whole cavity of the mouth. These people may also feel that their tongue is enlarged. They may feel that it's bigger when they start seeing symptoms of illness or disease. So we can check next on our list. Is your tongue too small? Is it perfectly in the middle? Or is it enlarged? Next, we can look at the tongue coating thickness. On the left-hand side of the screen, this tongue has absolutely no coating. As you can see, it's a little bit shiny. Shiny because there's no coating, slick like the mirror. In the middle, though the coating is not absolutely visible, this we call thin white coating as compared to the one on the left, because the left one we call guang tai, no coating, and that shiny appearance of no coating, completely smooth. On the other hand, on the picture on the right, you see an extremely thick coating. Now, anything between the middle slide of normal, anything thicker than that, all the way to the thickness of the slide on the right, will all be categorized as too thick. Not necessarily you have a coating as thick as this person's tongue on the right, but anything thicker than the middle one is too thick, and we need to say that you have classification of thick tongue coating. The one on the left is quite severe. People taking pain medications will actually usually have this tongue. But other than that, the disease is usually quite severe by the time the tongue looks like this. Next, we can look at the color of the coating. We want white. That's quite normal. And if it gets thicker, you can see an obvious color to the coating. So on the left, you can see that the coating is white. It's very pale in color, as opposed to the tongue on the far right, which has yellow. Now you have to be careful when you look at the coating of the tongue, because the coating can be dyed. If you're sucking on a bright red throat lozenge, your tongue coating will be bright red. If you just drank some grape juice, your coating will probably be purple. If you just had chocolate or even black beans, you may have a dark brown or black tongue coating. If you have not had any chocolate, black beans, or other dark colored food, and you still see a tinge of dark brown or gray, this is actually another type of coating. It's not as rare. It's usually in chronic conditions. I didn't include it here today. But in general, we will look for today, do you have more of a yellow coating or more of a white coating? Or are you perfectly thin in the middle and white? Okay, did you have time to check? Okay, let's go on to the next slide. This is the amount of moisture we have in the tongue. Hopefully you all have a perfectly healthy tongue like the one in the middle, but if you don't, you may have a little bit too moist or too dry of a tongue. This can also give us clues as to what's going on inside the body. On the left-hand side, if you can see, this tongue is a little bit shiny from the amount of water left on the tongue. Some people have so much water on the tongue that it's dripping when they stick their tongue out. And on the other side, on the right-hand side, this picture of the tongue, the coating is very dry. Not only is the coating dry, but the tongue has cracks in it. And the cracks can get more severe than the picture seen here. So we just try to put on the scale from extremely wet to extremely dry. Which of these polar opposites are you closer to? Perfectly in the middle, a little too wet, or a little too dry? Next, we can see if you have any of the special signs on your tongue. Not everybody does, and you might not necessarily have all three if you do, but if you have any of them, then you'll make a note and we'll come back and see what that means. The first picture on the left is a picture of a scalloped tongue. Do you see the teeth indentations around the edge of the tongue? This is one special sign that you may notice. Some people with light indentation is actually normal, but this indentation or this scalloped tongue is quite pronounced, and this is telling us, especially coupled with the other things we see on that tongue, it's telling us that there's something wrong with the body. In the middle, you can see this tongue has lots of red dots. Sometimes you can even feel the dots. They're raised bumps on the tongue. Usually they're concentrated in the front tip of the tongue, but not necessarily. They sometimes can be distributed all through the body of the tongue. And on the right-hand side slide, you can see on the tip and around the edges purple spots or purple patches. The body of the tongue has discolorations on the sides and on the tip. This is the third special sign we can look for. When you see these special signs, they usually jump right out at you, and it's not hard to miss, especially red dots and purple patches and scalloped edges. Finally, we'll look underneath the tongue. What are we looking for underneath the tongue? We're usually looking for two characteristics. First of all, we look for the two veins on either side of the midline. We would like the veins to be the length of 2/3 the tongue, from the base of the tongue where it connects to the bottom of the mouth to the tip of the tongue. We would also like them to be not too thick and not too thin. If we look at the picture on the left, this is a normal tongue veins underneath the tongue. They haven't completely disappeared. They're not too faint, but they're not too large or too long either. The other slide, on the other hand, has quite bulging veins, and they are a little bit long. On the sides of the tongue, you can see a lot of other veins that have also popped out. So this is indicating something's wrong with the body. The second characteristic we look at underneath the tongue is the color of the tongue. Sometimes on top of the tongue, you may notice that the coating is so thick and so coating the entire tongue that it's hard to see the body of the tongue. You may be able to see only around the edges, but if you look under the tongue at the color, you can notice that the tongue on the left is more pink, whereas the tongue on the right is more red. So hopefully you can see in just a few seconds a snapshot at the bottom of your tongue. If you've been looking at your tongue the whole time, the veins are probably popping out, and this doesn't count. You have to take a quick couple-second snapshot, or you have to let your tongue rest for a few minutes before you try again. So let's take a quick look at those slides again, and we'll see a general trend in heat or cold in the body. Chinese medicine diagnoses in terms of yin and yang. That simply means, is there too much or too little heat in the body, too much or too little cold? Is there excess problems in the body, like stagnation or poor circulation? Dampness, something of a water metabolism problem, or is there deficiency, not enough of something in the body? So the normal tongue, they pass. They have everything nice. If we look at the next slide, we get to the color. So were you running red or pale, nice and pink? If you are a little on the red side, red is indicating running hot, a little bit of heat, or too much yang or too little yin in the body. On the other hand, we have the pale tongue, which is more indicative of cold. And the purpleness is telling us that there's poor circulation or stagnation in the body that can result from a variety of reasons. So red, too hot; white, too cold. If we look at the size of the tongue, we can see the small tongue and the large tongue. These are both indicating deficiencies or weaknesses in the body of different kinds. So too small and too large, both indicating deficiency, though the enlarged tongue may also tell us about dampness or a sticky condition in the body, of poor water metabolism. If we look at the next slide, we can look at the thickness of the coating. This is telling us about the strength or weakness of the digestive system. On the left-hand side, the tongue with absolutely no coating that's quite glossy is showing us extreme digestive weakness. Like I mentioned, the people that are taking the pain pills, that's very hard on the stomach lining and other parts of the digestive system. On the other hand, the right-hand side picture is showing us a lot of accumulation of a dampness. This idea of food and fluids that we put in the body not digesting properly, and it creates a sticky condition where the body isn't cleaned out properly, and we need to flush out or transform the dampness. So digestive deficiency versus excess dampness in the body. Next, if we look at the tongue coating color, we can see again the idea of heat and cold in the body. So the more white the coating and the thicker, usually the more cold you have in the body. The more yellow the coating, usually the more heat you have in the body. And if you saw that tinge of brown, gray, and you know that your tongue has not been dyed from eating any dark-colored foods, then you may have more of a chronic condition. Chronic conditions tend to have a slight coating of that brown-gray on the top. The moisture level can also indicate the level of heat or cold in the body. The more heat, you can easily imagine it burning off the fluids in the body. So if we look at the right-hand slide of that dry coating with cracking in the tongue, it usually indicates some kind of heat in the body. Whereas if we have a very moist, watery coating on the tongue or lots of saliva, this is usually an issue of cold and or too much dampness in the body. For the special signs, if you noticed any of those on your tongue, the first one, the scalloped edges or the indentation, is telling us that there is digestive or qi deficiency in the body. The middle one with the red dots is telling us heat, too much heat in the body. If it's on the center tip, it's usually concentrated in heart and lung area, and we can tell these people usually have some insomnia. The coating on the right-hand side is actually not what we're looking for the special sign, but if you can see those purple spots on the sides and the tip, this is telling us there is stagnation located in the heart or lungs and on the sides in the liver or gallbladder. If we look underneath the tongue, we can also tell what's going on in the body, the left being the normal and the right side showing a little bit too much heat from the color of red again. And then we can also tell that these bulging veins have too much stagnation in the body. So poor circulation, accumulation of excess that needs to be flushed out of the body. Now if we put all of those signs together and try to come up with a correct diagnosis, we take this one for our first example. Deficiency heat tongue. So we see that the heat signs are several. First of all, we look at the color. It's quite red, red indicating heat. We look at the size of the tongue. The tongue is too small, so it's deficiency. This can tell us, oh, can we have that slide back? This can tell us that the deficiency heat means that there is not enough fluids and blood in the body. Deficient of good fluid and blood, sort of like a rough translation of dehydration, creating heat. We can also see many little red dots spread out all over the tongue. This is enforcing the idea that there's too much heat in the body. If we look at the coating, it's extremely thin. It's not shiny thin like the Guang Tai, the absolutely no tongue coating, but it is very thin. If it were thick, we may think that it's more associated with excess damp heat. But this one is extremely thin, so that's another sign that's showing us this is deficiency heat. Underneath, their veins might be quite thin or non-existent, again signifying the deficiency in the body. This person may suffer from night sweats, they may feel irritable, they may have insomnia, they may feel flush without having a fever, and they may have constipation or firm stools. These are all signs of yin deficiency with heat. So this is one way that we can put all of the signs together and come up with a correct diagnosis. If we look at one more example, we can see this deficiency, cold, dampness together for our spleen qi deficiency diagnosis. In this, we first look at the color of the tongue. It's actually pretty pink, not too pale. If we look at the size of the tongue, it's not too large, not too small, possibly starting to get a little bit enlarged. If we look at the coating, it's white color, but it's much too thick. The thickness is telling us dampness in the body, and the white is telling us cold in the body. So cold dampness is usually created by a weak digestive system. If the digestive system is weak, it cannot properly digest the food and liquid that we intake, and therefore we create over time a sticky condition in the body. This is further reinforced by the scalloped edge that you see around the tongue. This scalloped edge is indicating some kind of qi deficiency, digestive deficiency, and possibly blood deficiency, but this tongue is not pale enough for blood deficiency. We also may notice that if the tongue were a little bit more enlarged and on the pale side, we may diagnose them with kidney yang deficiency, because as the digestive system is weakened, it draws on the kidney warmth to continue digesting the food. And after a certain period of time, the kidneys will also start to become weak. When this happens, this tongue will continue to enlarge and become pale, and then we'll have kidney yang deficiency. The current tongue that you see will probably have different symptoms like chronic loose stools. They may have fatigue. They may have a lowered immune system, always catching colds. So these are some of the signs of the spleen qi deficiency. We hope that you can put together some of the signs that you've seen today and come up with a diagnosis for fun for yourself. Of course, this is not to replace your traditional Chinese medicine practitioner's diagnosis, but it's always nice to know when you go into your practitioner, what exactly are they looking for? What are they looking at? Why do they want to see my tongue? People always think it's a little strange when I say, let me take your pulse, I can tell about your organs, let me look at your tongue, I can tell what's going on in the body. If you just understand a little bit about what we're looking for and why we're looking at it, then you will be able to communicate more effectively with your practitioner, and you will be able to monitor your progress, and in the future you will be able to hopefully help yourself understand how different foods affect you. How does lack of sleep affect you? Staying up all night, you could notice in the morning that your tongue may be a little more red. If you eat too much oily foods or too much cheesy kind of foods, you may notice that your tongue coating is quite thick. This is all fun to monitor and observe and see how your body changes. The more sensitive you can become to your body, the healthier you'll become. I hope you can stay tuned for next time. Thank you so much today for watching, and mahalo.